Chapter 13 is about the ear. This is the last chapter of this unit, and it's the shortest and probably easiest chapter in the entire textbook. As you can imagine, the function of the ear is to allow you to hear sensory information. We hear sound waves vibrate through the ear, and then those vibrations are transformed into nerve impulses carried to the brain, and that's how we interpret hearing information. But it also gives us a sense of balance. As you learn, there's tiny little hairs inside the cochlea part of the ear, and those hairs and the way that they move give us a sense of balance. So if you ever feel dizzy, it's an issue with that part of your ear. The ear itself is made up of 3 different parts. There's the external ear, the middle ear, and the inner ear. That inner ear portion is also called the labyrinth, and I'll kind of explain why that is in a little bit. The first thing we're going to do is walk through the key parts of the ear and structures, and then we will attach the medical terms that go along with them. Here's the large picture of the entire ear, all 3 sections. This picture is in your book on page 555 also. In the next few slides, I'm going to walk through the key parts of each one of those sections of the ear. The external ear has 2 major components. The auricle, also called the pinna, those 2 terms are kind of used interchangeably. That's basically what you know as your earlobe. And there obviously you have 1 for each ear. And its main purpose is to just funnel the sound waves from the outside world into the other major portion of the external ear called the external auditory meatus. Meatus is a medical term that just is a fancy way of saying a canal or a tube. So it's also called the external auditory canal or your ear canal. And this helps funnel the sound waves down to your eardrum, which is in the next portion of the ear. But this part also has its inner part lining into the temporal bone of the skull, and that's where the glands that secrete cerumen are located. Cerumen is the fancy medical word for earwax. So that's why the earwax builds up in the external auditory meatus. The next portion of the ear is the middle ear, and it starts with the eardrum, also called the tympanic membrane, and its job is to vibrate when the sound waves come in through the external auditory meatus. Those waves cause the tympanic membrane to vibrate, and then those vibrations cause the next part of the middle ear to vibrate, and that transmits signals. The next portion are called the ossicles. I'm going to get into more of them on the next slide, but the ossicles are a collection of 3 bones that vibrate and carry those sound vibrations to the next portion of the ear. These 3 tiny bones are the smallest bones in your body, and again I'll get into them in the next slide. Also mentioned here is the tube that connects the middle ear to the pharynx. So this tiny Eustachian tube, it's basically a small tube leading to the throat area with the purpose of equalizing pressure. If you've ever, ridden on an airplane, for example, and your ears feel like they're going to pop, sometimes chewing gum and swallowing, those kind of things, getting the pharynx going can help to relieve the pressure in the ears. So if you didn't have that little tube to kind of equalize pressure, then you could potentially, blow your eardrums or your tympanic membranes. So again, those 3 little tiny bones are collectively called ossicles, but they do have individual names as well: the malleus, the incus, and the stapes. Or you might have heard them referred to as the hammer, the anvil, and the stirrup, which are what they, look like in everyday life, so to speak. But the stapes is that small stirrup-shaped bone, and it is connected to the oval window, and that oval window is going to lead us into the inner part of the ear. So the inner ear is also called the labyrinth, and it's kind of called that because of the way that the inner ear is shaped. That contains a cochlea. The cochlea is the snail-shaped part, or the kind of circular portion, and that is considered the organ of hearing. And inside the cochlea, that's where there are tiny hairs that when the sound vibrations come off the oval window, those three little bones in the middle ear, the ossicles, vibrate onto the oval window, and then that causes these little hairs in the cochlea to bend in certain ways, and then that information is transferred into impulses to the brain so we can interpret those sounds. We also have semilunar canals, which are attached to the cochlea in the inner ear and the vestibule. This is where receptors and something called endolymph, it's basically the fluid that's inside these canals. And that fluid and the way that it flows is how we maintain a sense of balance. The last one on this list we're not really going to talk about, the mastoid bone in the cells. The mastoid bone is located in the skull bone behind your external auditory meatus, so behind your ear canal. You can feel behind your ears too, you have a mastoid process, and that's where that mastoid bone is. You can kind of see it in the pictures in your book. Tracing the pathway of sound, just recapping the different parts of the ear. We first start with the auricle or pinna, your earlobe. The sound waves are then funneled in through the external auditory meatus or canal. Those sound waves will then hit the tympanic membrane or your eardrum, causing it to vibrate. Those vibrations in turn cause your ossicles, those three little bones, to vibrate onto the oval window. The oval window vibrates, causing the cochlea to interpret that information, and then that information is converted into nerve impulses by the acoustic nerve, and then that information will travel to the temporal lobe of your brain where you interpret the sound. Now that you have the anatomy and function of the ear down, we're going to begin to learn the combining forms used with this anatomy and functionality. Here's the list of combining forms for the ear. Most of them are pretty self-explanatory, but I do want to make a special note here. Starting off, we have audio. Audio means hearing. So this has to do with your ear's ability to hear information, or your ability to hear things. It doesn't have to do necessarily with, infections of the ear or issues with the structure of the ear itself. It has to do with the hearing. The issues with the ear itself, that's where we have the next list of terms, ori, oro, and oto. All three of those reference ear. Most commonly, we're going to use auto or oto, depending on how you want to pronounce it, but all three of those can be kind of used interchangeably. The others are kind of self-explanatory. We have cochleo, which means references the cochlea. However, it can mean the entire inner ear. Labyrintho means the entire inner ear, or the labyrinth area of the ear. Mastoido obviously goes to the mastoid bone behind the external auditory meatus. Maringo references the tympanic membrane. That one doesn't really sound like what it is, but maringo is used specifically for the eardrum. But you'll notice later on down the list we have tympano, which you would imagine would go for the tympanic membrane or the eardrum. And it can mean your eardrum, but usually tympano is referencing the entire middle ear. If you're differentiating, maringo will be used specifically for the eardrum itself, whereas tympano is usually used to reference the entire middle ear, which includes the eardrum and the ossicles and the oval window. We have stapedo, which goes to the stapes, that third little tiny ossicle, and vestibulo, which goes for the vestibule, which we will reference once or twice later on. Take a moment, if you have a diagram, go ahead and add these to your diagram or add them to your textbook on page 558 to kind of have them down before we move to the medical terms. Here the question is asking you, what is the combining form for eardrum? And this one should be pretty easy. You should be choosing A. If I wanted to make it a little more difficult, I would have put tympano on there. But one thing that I was told as an easy way to remember the eardrum as maringo is to think of Ringo Starr. And I know all of you are young and might not know who that is, but that is the drummer for the Beatles. So if you think of Ringo Starr beating on his drum, that's why you get Ringo for eardrum. It's silly, but if you think of weird things like that, it's sometimes easy to remember. Here we're just recapping those helpful hints on how to differentiate when to use which term. This is the entire list of diseases and disorders built from word parts. You will notice it is quite short. Most of these, as you'll also notice, end in itis, which means inflammation of. The various parts of the ear can become oftentimes infected and inflamed. So we can have labyrinthitis, which would be generally inflammation of the labyrinth or inner ear. Mastoiditis, which would be inflammation of that mastoid bone. It sounds a little weird, but yes, bones can become inflamed as well. Laryngitis would be inflammation of your tympanic membrane or eardrum. We can also have otalgia. If we remember, the suffix algia means pain. So when we combine it with oto, notice how the O in oto is removed because algia as a suffix starts with a vowel. Otalgia would just generally mean pain in the ear. It's not a very specific term. We have otomastoiditis, which is another inflammation. In this case, you have two word roots, so you would have both your ear and your mastoid bone inflamed. We can also have otomycosis. If you remember, osis is an abnormal condition, and myco is fungus. So as gross as it sounds, otomycosis is where you have an abnormal condition of fungus in your ear. Usually this condition would be in your ear canal or your external auditory meatus. Due to some kind of, exposure, the fungus gets into your ear canal and can cause an infection. We can also have otopyorrhea. Rhea means discharge or flow of. If we remember, pyo means pus. So otopyorrhea would basically mean a discharge of pus from the ear. For whatever reason, you have pus coming from the ear, usually by some kind of infection. You can also just have, generally speaking, otorrhea. So you can have other things besides pus discharging from your ear, whether it's blood or even cerebral spinal fluid can come out through your ear, other things besides specifically pus. The last term, otosclerosis. Sclerosis means a hardening of. This references the stapes, that third little ossicle bone in the middle ear. specifically. There is a irregular bone development that sometimes happens with the stapes, and it causes it to harden. And therefore, when your sound waves are coming in and the ossicles are normally vibrating, the hardening causes the vibrations to become less and less and less over time, and that's what can lead to hearing loss. Take a moment now, try exercise 6. It's on page 560 and 561 of your book, just to use these before we go on to the ones that are not built from word parts. This is the list of diseases not built from word parts. Again, it's pretty short. The first is acoustic neuroma, and it kind of looks like it's built from word parts. If you remember, oma means tumor, and neuro means nerve. So this, in this case, is a tumor on the acoustic nerve, which is the cranial nerve that helps to transmit sounds to the ear. And therefore, having a tumor in that area could lead to hearing loss or hearing damage. A ceruminoma is also a tumor, in this case on the gland that secretes cerumen. If you remember, cerumen is earwax. The next term, a cholesteatoma, is another tumor, or a cyst-like mass in this case, and it's usually composed mostly of cholesterol, which is why it gets its name. And this usually sits in the middle ear and can cause chronic, or is usually associated with chronic otitis media, which is another word on this list. Otitis media, I think otitis means inflammation, in this case the middle ear. So anytime you have inflammation in the area between the tympanic membrane and the oval window, that would be otitis media, which is the exact same thing as tympanitis. If we remember, tympano means middle ear. So both of those two terms can be used interchangeably. One is technically from word parts and one is not. Meniere's disease is an eponym named after the person who, first cataloged it. It's a chronic disease, meaning that it's something that individuals live with over the long term. And it affects the inner ear. So you get vertigo, which is another term on this list. It's a kind of spinning motion. It has to do with the semilunar canals and the endolymph fluid. You get constant vertigo, so you feel dizzy a lot or feel like you're spinning. You also have something called tinnitus, which is another word on this list, which is the fancy way of saying you have ringing in your ears. You can also have fluctuating hearing loss. So all of those things are associated with Meniere's disease, and it kind of comes and goes. The next term, otitis externa, is inflammation of the external ear, whether it be the pinna or the external auditory meatus. There's something inflamed in that region. And then again, inflammation of the middle ear is otitis media, also known as tympanitis. The last term that I haven't talked about is presbycusis, and we saw the presby word part before when we were looking at the eye chapter. Presby as a it's not an official word root, but it usually is associated with aging. So presbycusis is the fancy way of saying you are losing your hearing as you age, or your hearing ability diminishes as a result of aging. This is a picture of what otitis externa looks like. You can see the eardrum or the tympanic membrane in the back middle. And so what you're looking at is the external auditory meatus, and you can see how it's red and inflamed and basically very sad looking. This is an example of otitis media. You can see that the tympanic membrane is not happy at all. You're using part B as a reference. That's what a happy, healthy looking tympanic membrane looks like. Whereas on the left you can see that it's kind of swollen, it's red. In some instances, it can be perforated. Those are all parts or associations with otitis media. Hearing impairment occurring with age or associated with age. Hopefully you chose B, presbycusis. A few slides ago I mentioned that presby is associated with aging. And otosclerosis is the hardening of the stapes that can lead to hearing loss. Here is a list of surgical terms that are built from word parts. The first one, a cochlear implant, is a common surgical procedure that's becoming increasingly common over time. Basically what it is a electronic device is inserted partially inside the skull, partially outside, and what it does is its job is to convert sound wave signals into electrical impulses. And therefore, these electrical impulses can then stimulate the auditory nerve like a normal signal transduction would, so you can interpret that signal. It bypasses the damaged part of the ear. Usually this cochlear implant is used whenever, maybe the hair cells in the cochlea are damaged or not working. It bypasses that inability of the inner ear to take sound waves and convert them. The other terms on this list are mostly incisions and removals. So, for example, a labyrinthectomy would be excision of the labyrinth, or that entire inner ear area. Mastoidectomy would be removal of the mastoid. But you could also have a mastoidotomy, which would be an incision into the bone. Let's see. We also have laryngoplasty. Plasty means surgical repair. So in this case, laryngo meaning tympanic membrane, maybe you've heard of, people telling you don't stand so close to really loud speakers, you could blow an eardrum. It is possible to perforate or essentially blow your eardrum from loud noises. Sometimes it could get punctured for some reason due to an accident. So laryngoplasty is the surgical repairing of that damaged eardrum. A laryngotomy otomy would be to purposefully insert or make an incision into the eardrum. And you might ask yourself, why would you possibly want to do this? Usually it would be to alleviate pressure in the middle ear. Maybe there's some kind of pus buildup in the middle ear, for example. So you make an incision so that the middle ear can drain, and then you can begin to repair the eardrum. Stapedectomy. This is something that might be done if you are suffering from otosclerosis, for example. You might remove the stapes, and what happens usually in that case is they would remove the hardened stapes that's not functioning really as it should, and then they put in a little tiny baby prosthetic stapes instead, and that usually can restore the hearing loss of the affected individual. And the last term, tympanoplasty, this would be any type of surgical repair of hearing from the middle ear to the ossicles. So that's kind of the generic term that would include things like a laryngotomy, a laryngoplasty, a stapedectomy, anything in the middle ear area that's being repaired. That's kind of the blanket term. Here's just a cartoon visual of what a cochlear implant kind of looks like. You have a very tiny transmitter and speech processor on the outside of the individual's skull. next to the ear. Then there's a tiny microphone that then can transmit that information through the skull to a receiver that has a tiny electrode cord going all the way down into the cochlea. So when there's a message transmitted, then it will stimulate the electrodes in the cochlea that can then transmit that message into electronic signals. This cartoon demonstrates what a stapedectomy would be. Again, usually used to treat otosclerosis, where the stapes is hardened. So in the picture on the left, you can see the stapes has been already removed. So you would take that out, and then what you would do is, the picture on the right, you come up with some kind of prosthesis. In this case, it's kind of a combination of a wire and some fat. And you can restore hearing in this way because now the ossicles will vibrate as they should. Okay, so here are the diagnostic terms built from word parts. You'll notice many of them have common word roots. It's all in the suffixes here. So you have an audiogram, audiometer, and audiometry. Audio means hearing, so all three of these have to do with the ability to hear. So a gram is going to be the actual record of your hearing, the graphic image, for example, or the readout. The audiometer is the instrument that actually measures the hearing, and audiometry is the term for the process. So for example, a doctor would do audiometry with an audiometer, and the end product would be an audiogram that tells us how well you can hear. We also have electrocochleography. Graphy means the process of recording. So it's the procedure in this case. Just like metry is the procedure of measuring something, graphy is the procedure of recording, in this case, electrical activity of the cochlea. We have otoscope and otoscopy. Otoscopy is the procedure of visually examining the ear or looking at the ear. And you do this using an otoscope. It's that, thing that the doctor uses typically in the standard doctor's office. It's kind of like a circle on a handle, and then he jams it into your ear to see what's going on anytime you have a potential ear infection. We also have tympanometer and tympanometry, similar to audio, except in this case it's dealing with the middle ear. So tympanometry would be measuring the movements of the tympanic membrane, your eardrum. Could also be for the stapes, anything in the middle ear, and this is done using a tympanometer. Take a moment, try exercise 18, just because a lot of these are hard to keep straight, so you have to make sure you fully understand all of the suffixes. This is just kind of a review picture here. So we have a visual examination of the ear is performed with the instrument used for visual examination of the ear. If you think back to the previous slide, this would be otoscopy, performed with an otoscope. We are now to the complementary terms built from word parts. There's two groups of words that can sometimes be mixed up. The first is audiologist and audiology. This pair references hearing. So audiology is the study of hearing, and this is done by an audiologist. This is the doctor that would do hearing tests if there's suspected hearing loss. make recommendations for hearing aids and cochlear implants, things like that. In contrast, we have otology and otologist. This is the specialty that deals with diseases of the ear itself. So an otologist, the person who studies this, would be looking at, ear infections and other issues, even otosclerosis, any type of condition with the actual ear itself. Other terms on here have the suffixes that mean pertaining to. So we have oral, which means pertaining to the ear. Note the spelling here. It's pronounced oral, but don't get confused with oral, meaning pertaining to the mouth. Cochlear, pertaining to the cochlea. We have a giant long word, otorhinolaryngologist. And if you broke it down into its parts, we have oto, which is ear, rhino, which is nose, laryngo, which is your throat. So this is the specialist who deals with those three areas. So that's typically the ear, nose, and throat doctor is what they are called. We have vestibular, pertaining to the vestibule, and then the last one, vestibulocochlear, is just pertaining to those two different areas. So take a moment and try exercise 22 just to get these words straight before we move on to the abbreviations. There's only a few abbreviations here. We have AOM and just OM. Both of them reference otitis media, which is the inflammation of the middle ear. And acute means that it's sudden, or it kind of occurs randomly, and then you can be treated and be done. So maybe it's some type of bacterial infection, for example. So that's when you would use acute otitis media. If it's a chronic condition like otosclerosis, for example, giving issues, or a chronic condition, you would just use OM. As mentioned in the last group of words, we had otorhinolaryngologist, which is the ear, nose, and throat doctor. So to abbreviate, we use ENT, standing for ear, nose, and throat, just to make it easier. But if you go through some extra training, you as a doctor could be an EENT, which would be an ear, eye, nose, and throat doctor. So it just kind of depends on what you would want your specialty to be. So as always, at the end of the chapter, I encourage you to do the exercises that kind of pool all the words from the chapter together. It's one thing to be able to memorize them in their separate lists, but you have to understand what these words are in context. So for starters, see if you can read through this slide, out loud, using these words, pronouncing them correctly, and actually understanding the context of what it's talking about. Then go ahead and try, exercise 25 is on page 572 in your book, as well as, working on exercise 26, where you have to choose the correct word. All of those are excellent review exercises to help you prepare for the test.